Hello and welcome to another live broadcast with MedStar Health. My name is Michelle Bowman and I'm joined here today by Dr. Barbara Srichai-Parsia, Director of the MedStar Heart and Vascular Institute's Women's Heart Health Program and Vice Chief of Cardiology here at MedStar Georgetown University Hospital. We're excited to talk with Dr. Srichai today about heart disease, common myths about it, and how it affects women in particular. So if you're curious to learn more, stick around, share this broadcast with your friends, and feel free to share comments and questions with us in the comment section below. Thank you so much for joining us today. How are you?
I'm doing fine.
Thank you. Thanks for your time. Before we get started, could you share a little bit about yourself, why you chose cardiology as your specialty, and how you became interested in helping women improve their heart health in particular?
Absolutely. Well, I was always interested in science and math as a student, and I like to understand how things work. I actually got interested in cardiology when I started doing some research, looking at how the heart changes after heart attacks, something we call remodeling, the shape and the function of the heart. And that got me more interested in pursuing a career in cardiology. With that work, I also got exposed to advanced imaging techniques that we use to understand the heart better, why it does what it does, how the blood flow is and all that. And it helps us understand disease processes going on in the heart, particularly things that again, I like to understand things, the things that we don't understand. And women's heart disease is one thing that I feel like we don't really understand.
Right.
And so these new techniques out there are helping us to understand this better. Additionally, my mother was diagnosed with heart disease a few years ago, and it's just surprising that all the symptoms she had, she didn't realize that it was actually her heart that was causing her symptoms. And so that was also something that made it more of interest to me to help other women understand how some symptoms that they think are just nothing or it's just something that is related to anxiety could actually be from the heart.
That is very interesting, yeah. Thank you so much for that. So, as I mentioned earlier, you are director of the MedStar Heart and Vascular Institute Women's Heart Health Program. So, could you explain a little more about that particular initiative?
Absolutely. So this program started about a year ago, in February 2019. Our mission is to increase awareness and to prevent heart disease development and progression in women. I think that first starts with awareness and realizing that you might have heart disease. We have a core group of about 16 cardiologists in our system who are committed to this mission, and we've developed common protocols for evaluating women who might be at risk for heart disease, and we're in the process of creating additional protocols in terms of downstream management in women who actually do have heart disease. We have also developed a women's heart health quiz that's available on our website and available to anybody who would like to take it to see if they have an increased risk for heart disease and just to kind of understand their personal risks. And then our MedStar Health team has also helped us with being out there more on social media sites to help increase awareness, part of our campaign initiative. In addition to that, we're trying to increase our community engagement. We've joined with a Women's Heart Program, a national program that's based here in DC that focuses on or advocates for women's heart health awareness. And as I said, we hopefully in this coming year will increase our community engagement in this process.
That's fantastic. Yeah, and it's very important to know because as you know, in particular, more than I do, of course, heart disease affects women a little differently than it does in men. So we're going to explore that today, and as we dig into the questions that we have. So along those lines, what are the most important facts that women need to know about heart disease?
So first and foremost, I think it's important for women to realize that heart disease and stroke actually affect 1 in 3 women. So it's a pretty high number.
Yeah, that's a high number.
And women live longer than men, at least now we do. And so they're going to be affected a lot more compared to their male counterparts, even though it's advertised as a male disease.
Right.
So fortunately, a lot of this risk, though, can be attenuated because a lot of it has to do with increasing our awareness and the things that we're doing that could be harming us in the future, and steps we can take to mitigate this. So it's important that women right now learn more about heart disease and take action so that they don't develop heart disease.
So in order for us to learn more about heart disease, could we dig into what are the particular causes? What what actually causes heart disease.
Right. So heart disease is kind of a broad term. I think the most common manifestation of heart disease that we see is somebody having a heart attack or heart damage damage to their heart muscle. And this is often caused by narrowing in the heart arteries that supply blood flow to the heart muscle. The narrowings are usually caused by buildup of plaque, cholesterol, inflammatory mediators, and the buildup of plaque leads to narrowing, which then decreases the blood flow. On occasion, we can get cracks in that plaque, which then can cause blood clots to form. When the blood clots form in the arteries that go to the heart muscle, that causes heart attacks. When it happens in other areas of the body, particularly like to our brain, then it can cause things like stroke. So it's a similar process, but just depends upon where the blood flow is going.
Okay.
The other thing that can occur, and happens to occur more often in women, is maybe there's no specific plaque buildup, but it's actually that the vessels don't react well, that in certain situations when they need to relax, they don't relax well, and that can also cause symptoms that mimic a heart attack as well. And we're still trying to understand this a little bit better. So that's the most common form, but there are other types of heart diseases out there. So there's diseases that cause weakening of the heart muscle, separate from blockages in the heart arteries, and can lead to symptoms of heart failure or congestion. People could have symptoms where their heart rhythm gets out of whack, and then they get symptoms just based on the electrical system issues. And then finally, the valves. There are 4 main valves in the heart, and if any of them become dysfunctional, either leaky or too tight, then that can also cause problems and also heart disease.
That is very interesting. Now that we've explained what the causes of heart disease are and the many types that exist, let's take some time to go through some of the common myths and dispel them with the facts about women and heart disease in particular. And if you're just joining us, I should say, feel free to comment, ask questions in the comments below. We're talking about women's heart health and how it particularly affects, how heart disease particularly affects women. So the first myth that we have is that heart disease is just for older people. And of course, we know that's not true.
So heart disease affects women of all ages. The most common type, as I mentioned, that we think of are blockages in the heart arteries. And it is true that as we get older, the risk does increase. But for younger women, actually, the combination of use of birth control pills and smoking actually increases their risk by 20%.
Wow, I did not know that.
Other things that can increase our risk are overeating, a sedentary lifestyle, being overweight. Those are all other kind of factors we don't think about, but that can also affect our risk. Finally, I think for women, which is interesting, I think certain aspects of pregnancy, having difficult pregnancy, preeclampsia during pregnancy, also can increase our risk of heart disease.
Okay, and the second myth that we have is heart disease doesn't affect women who are fit.
And while I'd like to think that that was 100% true, that all we have to do is be fit, we have to be mindful that we are a product of our parents, and if your parents' and their relatives all had heart problems, the likelihood is that you have some kind of genetic component and are at an increased risk for heart disease. And so we have to be mindful for that. The other thing is that just because you're fit, it still doesn't negate these other factors that I mentioned, such as watching your cholesterol, watching your blood pressure. And so we do everything we can to decrease our risk, but unfortunately we can't make it 0% because there are certain factors that are just not controllable.
Another myth that we have is heart disease runs in my family, so there's nothing I can do about it.
And so that was what I referred to with the prior myth, in that there's some things that we can't help because it is in our genes. However, if it is in our genes, there are definitely that doesn't mean we should give up, because we definitely should try and modify these things that we can modify. So eat healthier, control your cholesterol, be active, because those will, and don't smoke if you do smoke, because those are all the things that will just make it worse or make the development of symptoms more sooner than if we do lead heart healthy lifestyles.
So that's a good point. Just because something runs in your family, you got to be proactive about your personal health. It's very important. I think that's all for the myths and dispelling them with our facts. So let's move on to our next question. How can someone find out about their personal risk for developing heart disease?
Okay. Well, first and foremost, I'm sure you guys have primary care doctors, and I would say the first thing is to go speak with your doctor about what your personal risks are, because a physician has a lot of knowledge and your personal physician knows a lot about you. The other thing is there are sites online that can help you understand your risks better. We have on our site, as I mentioned, a quiz that can help you learn more about your personal risks for having heart disease.
And we'll make sure to include that link in the comment section below, so stay tuned for that. As you mentioned, signs and symptoms of heart disease may present differently in women than in men. So let's discuss how heart disease warning signs show up in women, and could you share a few examples of the unique signs for women?
So when we think of heart disease and we think of heart attack, the classic thing we think of is the chest pain symptoms.
Right.
And when I hear chest pain, everybody has a different kind of aspect in what pain is. And so we think of the classic, something all of a sudden is hurting my chest.
You got tightness in your chest.
Tightness. Well, some people don't even consider tightness as pain.
Okay.
So they may tell me, no, it's not really pain. It's just a discomfort or a feeling or a sense. And I think it's important to note that that tends to I hear that a lot more in women than in men, and that often can be a sign that there's something going underlying heart disease. And so it's important to make sure you don't ignore these signs.
Exactly.
Other things that are more common in women are shortness of breath. That is not classically described, but in women we hear that a lot. Other kinds of symptoms are feeling of impending doom, feeling like your heart's racing, these kind of things that get attributed to anxiety or don't worry, it's just your nerves. Depending upon how symptomatic you are and what your background risk is, it could represent underlying heart disease. And finally, I think the other thing is nausea or discomfort, just GI upset, can also heartburn symptoms. That tends to be more typical in women than in men and could be a sign of underlying heart disease as well.
All right. As we shared before, we have the online quiz that's available for people to take and find out their risk. But what are some other good resources for women to learn more about heart health?
Well, the American Heart Association has excellent educational pages focused on women's heart health. And then as I mentioned, on our website as well, we have additional resources that are available for women who feel like they may have an increased risk of heart disease.
And final question that I have prepared, what are the most important takeaways or next steps that women should take from our conversation today? Okay.
Well, first, listen to your heart. Don't ignore we mentioned some of the warning signs and symptoms, so don't ignore them. That's your heart trying to tell you that it's suffering. Become an advocate for your own heart health. I think that's very important, and just being aware, and by participating here and making yourself more knowledgeable about some of the signs and symptoms of heart disease and what your personal risk could be is important. Take care of yourself. Try and live a heart healthy lifestyle, meaning try and exercise regularly, don't smoke, try and keep your cholesterol at a low level, know what your family history is, because as I mentioned, genetics are an important part, and then try to either lose or maintain a good healthy weight.
Great. These are all great tips, and thank you so much, Dr. Srichai, for spending time with us today. Thank you so much, everyone watching online. We hope that you found this information valuable and in achieving better heart health. For any other questions, feel free to share them in the comments below. We've shared important links that I think will be useful for you. With that said, that's all the time we have for today. We'll see you next time.